Can you tell me, first of all, what the position is on personal protective equipment?
Yeah.
We keep being promised there's more on the way, more on the way. Where are we?
Yes, the personal protective equipment is being driven out to all NHS and social care settings as we speak. There's a massive logistical operation underway, and I understand just how important it is, and I feel very strongly about that when we're asking people in the NHS to put themselves in harm's way to care for us all, then it's our duty to get them the equipment that they need. So I understand the concerns, of course I do, and we've put in place a helpline so you can phone in if you haven't got access to it.
So there still might be people at the end of today, the end of tomorrow, hospitals, where the kit isn't deployed. It's not there.
Well, we've put out a delivery to every hospital, and that was...
When did it go?
Well, that was dispatched from Friday, Saturday, Sunday. But the NHS, with 1.4 million workers, is a very big place, and making sure that you get them the right masks to the right people at the right time.
But they've been asking for weeks.
Logistical effort. Yes,
Haven't
we've been delivering this to the hospitals.
But they've been short for weeks. People have been saying there's concern for weeks.
We've been delivering this to the hospitals over the last few weeks, because we've obviously been able to see that the growth of the virus, while we're also taking the actions to try to clamp down on that. And I've now brought the military in to help improve the delivery of that.
What went wrong? This is improper, isn't it? Putting NHS staff in danger like this.
Well, I understand very deeply.
But what went wrong?
Well, I understand my responsibility to get this right and to make sure that people get the equipment they need. I think what's happened is that, understandably, over the last week or so, the demand for and use of the protective equipment has gone up very sharply.
Well, hang on, that's what an exponential pandemic is all about, isn't it? We knew it was going to go up. We knew from the middle of January when the WHO said there's a pandemic on the way, brace yourselves.
Yes.
So why wasn't this all done earlier?
Well, it has been. We've been working on this.
No, but they still haven't got the kit.
Well, when you say they...
the NHS staff.
We're constantly delivering more equipment. We've got to keep ahead of the need for it that there is in hospitals. And I'm working 24/7 on making that happen.
What's happening on testing? Because people are puzzled by that. There are other countries where an awful lot of testing seems to happen, and they seem to, if you look at some figures, have got a bit more on top of things. They seem to have a good story to tell from testing, and yet we're not doing it everywhere.
Well, we're increasing testing as fast as we can, and critically, we're buying some of the new tests that don't need the sample to go to the lab to get the result, but instead they're essentially a home test.
But you're buying them now.
Yes, because they've only just been invented. Absolutely.
Well, some of them have been around for a bit longer than that, and
we're buying them absolutely now. We've been buying them over the past weeks. This is something that we've been working on the whole way through. The challenge is to keep the testing numbers going up, and to make sure as many people as possible who need it, especially the patients in critical care units, and also the clinicians, the doctors, nurses,
who are still not getting tested as we speak.
Of course, the demand for it is very, very sharp.
But other countries are on top of it. They've done more testing. They've got hundreds of thousands of the tests going on. The Spanish are doing much more than us. We know more happened in South Korea and in China. Why not here? Do we have a different philosophical approach to this?
No, we're doing more than many other countries, and there's a huge race on to get as much testing as possible.
But it sounded like we weren't in that race. We didn't think it was a good idea for a while, and that's why we're behind.
No, that's not true. We've been ramping up the testing as much as possible, as fast as possible throughout.
Where are we on ventilators?
On ventilators, we started with around 5,000 in the NHS, and we've now bought so that we've got over 12,000. So that number is going up. That's in total, but we're still buying, and the call to arms that we put out to say manufacturing capacity needs to be turned over to ventilators, that has had an amazing response.
You spoke about that last weekend.
Yeah.
But again, the WHO, in the middle of January, said,
yes,
this thing's heading your way.
Yes.
You never thought 5,000 respirators would do it, did you?
That's right. So we've been buying all that time, absolutely. And
the number's only going up now. No. We've been low on ventilators for ages.
No, the number has been going up all that time as we've been buying ventilators. And the other thing that we've been doing over all of that time is training staff, because a ventilator is a highly technical piece of equipment, and it needs to have highly trained staff to make sure that people are safe using it.
But we could be woefully short of ventilators as things stand right now.
Well, at the moment...
How many do you think?
At the moment, we have the ventilators that we need, and we're buying more. And frankly, I could put a target on it, but no number is too high. We want as many ventilators as we can get our hands on.
I suppose what people wonder about is, was there this period between the middle of January when the WHO say this thing is coming towards you, and where we are now, maybe even the whole of February, where not enough was done, a grip was not got on the sort of supplies that would be needed in this kind of pandemic?
So Gary, I completely reject that. The supplies that we've got, for instance, on the protective equipment are vast. The challenge...
You just haven't got them out there.
Yes, the challenge...
But Amazon can get a kettle to you the next day. I mean, surely there should have been more effort made on that front.
The challenge is the logistical one of getting the kit out. And likewise, on ventilators, we've been buying them for weeks. And on the testing, Public Health England came up with one of the first tests in the world, and we've been ramping up since then. So, of course, this is a massive challenge for the country. Of course it is. And we're doing everything that we can. But we have been on this for weeks now. And, it may be that the severity of coronavirus may have only, come home to some people more recently. But we in the NHS and with Public Health England and across government have been working on this for weeks and weeks to make sure that we are as well prepared as possible. Another example is the contact tracing. At the start, when there were a small number of cases, we managed to keep the spread here slower than elsewhere because we did all of that contact tracing. That has bought us valuable time, meaning that we are behind France, Germany, Spain, and certainly Italy in the curve, giving us more time to get these things in place.
What did you think as you saw those images of the weekend of crowded beaches, open spaces, people too close together? What's gone wrong?
Well, I frankly thought that people were selfish not to be following the public health advice, because the more people who engage in unnecessary social contact, the more that this disease spreads, and the more people who will die, and the slower it will be to solve to get out of it. And I'm prepared to take the action that's necessary. We've already demonstrated that.
We're close to Italy. Why aren't we doing what is happening in Italy, and why aren't we doing it now?
Well, we've taken the action last week to take very severe restrictions on what people can do, and then.
But it didn't work. We just talked about that this weekend. It didn't work.
And then we've also taken the powers in order to make sure that people must follow those rules that we set out last week. And I am prepared to take the action that's necessary to keep people safe. Yes, and
it does sound as though he's the guy sort of pulling back opinion in the room a bit, holding back from sterner measures.
No, I mean the Prime Minister has worked 24/7 on this, an unbelievable amount.
Is he a good man to deliver a stern message?
Yes, and it's a hard look. Leading the country through this time requires you to follow the science, to listen to people's concerns, and then to take the action that's necessary. And we've demonstrated that we're prepared to take the action that's necessary. We will always follow the science. It's incredibly important. But we'll also do what is necessary to keep people safe and to protect life.
Very quick last question. Have you seen any evidence to suggest we're not heading fast in exactly the same direction as Italy?
Well, we are taking the actions earlier, in many cases, on the curve, the curve of the epidemiology, because we're further behind, and we've been able to see that the numbers go up. So we are prepared to do whatever it takes to get a grip on this disease and to keep people safe.
Why can't I find a scientist who thinks that? Who thinks you're doing the right things?
Well, that's what the vast majority of the scientific community think, including, of course, the top scientists like the Chief Scientific Advisor and the Chief Medical Officer.
Which makes some people wonder if something strange happens in that room, because the moment you go outside that room where they're meeting with the government, you can't find a scientist who agrees with that. They're all saying clamp down.
So I don't think that's true. I think if you look at the broad scientific community, then there is very strong support for the science on which we've published, on which we're taking the decisions, and making those decisions based on science is obviously critical to getting them right.